In this first exercise, we're going to be looking at how the body's organized and a lot of the terminology that is going to be used throughout the semester. I always recommend learn the terminology now because it'll make it much easier later down the road as we go to continue studying. We will be using these anatomical terms for areas of the body, directional terms, etc. from now on out. So if you learn it now, it will make it much easier later on. Obviously, this is anatomy physiology. The difference between the two is anatomy is looking at the structure, and then physiology is looking at the function. And one thing you will hear throughout A&P is that structure determines function. If you ever forget what something is supposed to be doing, look at the structure of it because that will often tell you what its function is. Look at the shape of it, look at the design of it, and that's going to give you clues as to what it's supposed to be doing. We're going to start first with anatomical position. Anatomical position is just this universal standard of how you're going to be viewing the body. This is the way most pictures are going to be drawn. And the anatomical position is with the individual standing up. They're facing forward. Their arms are going to be down by their side with the palms facing forward, and the toes are going to also be facing forward. Because the palms are facing forward, notice that the thumbs are going to be essentially furthest away from the body. That's going to become important later on as you use those as landmarks to identify various things. You'll notice with some of the directional terms, they're often in pairs. If you're going up there, you can also be going down. If you can be going right, you can be going left. We will use the anatomical terms, as I said, get used to starting to use them now, and we use them throughout the rest of the semester. Superior and inferior. Superior means closer to the head, inferior means closer to the feet. So you can use these terms in a couple of different ways. You could say, as it is shown here in the example, that the lungs are superior to the stomach. So it means the lungs are above the stomach. You could also say that the stomach is inferior to the lungs, so it's below it. Sometimes you will see the terms cranial in place of superior and caudal in place of inferior. Anterior and posterior. Anterior is towards the front, posterior is to the back. Once again, I know it's annoying, but we have another set of terms that you may see sometimes, ventral and dorsal. Ventral would be the same thing as anterior, dorsal, same thing as posterior. I'm sure at some point you're going to think that we are out to get the A&P students with all of our terminology. This diagram is just showing some of these terms that we use. Once again, just as a means of directional terms. The one you have not talked about yet is medial. Let me put a different color on this. Medial and lateral. Medial is towards the midline. If you think of a midline across the body, lateral is away from that midline. Excuse me. Proximal and distal are paired together. They are used only on the limbs, so only on the legs or the arms. Proximal means closer to this point of attachment to the body, so the shoulder or the hip. Distal is further away. And that's where these terms, once again, are defined here, as we just saw in the previous picture. Medial, closer to that midline. Lateral is further away. Intermediate is, as the name implies, come in the middle between those. So once again, the picture shown here. And I said, just keep in mind, one thing people will confuse with proximal and distal is they tend to try to use that on the torso, only use it on the arms or the legs. So the elbow is proximal to the wrist, meaning that The elbow is closer to the trunk, closer to the shoulder than what the wrist would be. Superficial and deep. Once again, another set of terms, external versus internal. Superficial means it's closer to, or maybe even actually on the surface of the body. Deep means it's internal. It's not on the surface. And once again, it is showing these different diagrams of the different pictures, the directional terms. Parietal and visceral, this pertains to some of the cavities and the lining. Parietal often refers to the wall of a body cavity. We'll see this when we talk about different membranes. Visceral tends to refer to organs, especially in the abdominal pelvic cavities. Contralateral is on the opposite side of the body. Ipsilateral is on the same side of the body. These are just some practice examples of using those anatomical terms. So the elbow is what to the wrist? Well, it's going to be proximal to the wrist. Once again, you're talking about the appendages. Think of the location of the chin as compared to the nose. It's below it, so it's inferior. The thumb is lateral to the forefinger. Remember how I mentioned the thumb and you're using these when the body's in anatomical position. So remember I said the thumb, because the palms are facing forward, the thumb is pointing outward. The forehead is superior to the mouth. The skin is superficial to the muscle. The spine is posterior to the esophagus. The mouth is medial to the ear. The spine is on the posterior side of the body. The right arm is ipsilateral to the right leg, and the hip is proximal to the knee. So these are just examples of it. Just get used to using those terms. We also can think of what we call sectional anatomy. This is where you have an imaginary plane that passes through the body, and you can do different types of sections or cuts. There's three main planes. You have the sagittal plane. This is going to divide the body into a left and right part. Now, if you go right down the midline, it would be referred to as a mid-sagittal. Parasagittal is going to run parallel to that, but it's not going to be exactly down the midline. The coronal plane or frontal plane, this is going to divide the body into an anterior and posterior portions. Remember, those terms would mean front and back. And then a transverse or horizontal plane divides the body into superior and inferior. Once again, those directional terms would mean a top and a bottom. And so this diagram is showing the different types of planes that you would have. So the medial plane is shown here. It's actually a mid-sagittal, where if you were to cut right here, and you end up with the right and the left sides. The frontal plane is cut in this direction, so you have a front and a back. And the transverse is cut right here, so you have a top and a bottom. These are examples of the three different types of planes and what you would be looking at. Some of you may be going into, say, sonography, and the doctor orders, or maybe x-ray techs, the doctor orders an MRI. Well, depending on what you're looking at may depend on how are you going to do those scans. What is it that you're wanting to see? Every situation is different. Excuse me. In terms of organizations within the human body, there is a distinct level of organization that occurs. You have your organs, which are very distinct structures. They carry out very specific functions. They are composed of two or more tissues. Those organs, several of them combine together to form an organ system. Once again, to carry out a specific function. The human body has 11 organ systems, as do most animals. And in the next chapter, we'll look a little bit more specifically at them. But as I said, there are 11 organ systems. You can look at regional anatomy, so you're hopefully starting to see now how when you study anatomy, people specialize, and some are more microscopic, some are more gross anatomy, some may be looking at systems, some may be looking at regional anatomy. It all just depends on how you divide it up. The body itself can be divided into two major divisions, the axial division and appendicular division. The axial is going to refer to the head, the neck, and the torso. Think of along a center line of the body. The appendicular division is going to include basically your arms and your legs, those extremities. You will need to know the anatomical terms that are listed in these following diagrams. Learn them now. It will make your life so much easier. And I know when you first see this, you think, oh my goodness, and you start maybe to get a little bit overwhelmed. But let me just give you an example. Right here, the brachium or the brachial, this is the upper arm right in here. If you learn this region right now, it's the brachial region, it's going to make it a whole lot easier later. Why? Because the muscle that's underneath here is the biceps brachia. The blood vessel, you've got a brachial artery, you have a brachial vein. You have a brachial nerve that goes through here. In some of these areas, like down here on the leg and on the anterior position, you have this area is known as the femur area or the femoral area. Well, the bone that is right here is the femur. You have biceps femoris. You have the femoral nerve. You have the femoral artery. So if you start to learn now the terms, when you go and you study the skeletal system and the muscular system and the nervous system and the cardiovascular system, it will all make those a little bit easier. Trust me, by the time you finish the course, you won't even think twice about, say, the knee areas, the patella. I would recommend that you get a picture, an unlabeled picture of that, put it into a plastic sleeve, and then get a marker and fill in the blanks. Erase it, fill them in again. That repetition is what's really going to help you. And if you put it in a plastic sleeve that you can just wipe off the marker, you don't have to make a whole bunch of copies, and they'll be a lot easier for you. Then just put all those plastic sleeves with the pictures in a binder, and you've got a really good study tool there. Regional anatomy, excuse me. Once again, the abdomen and the pelvic area is known as the abdominal pelvic region, and we often divide it into smaller segments. First, you can divide it into quadrants. Appreciate this now because we're really nice in the name. We have the upper right quadrant, the lower right quadrant, left upper quadrant, left lower quadrant. And when we talk about right and left, it's always going to be the patient's right and left. So just keep that in mind. This is going to help you kind of localize sometimes by region. Maybe a patient comes in and saying, well, I have some pain right here. Well, you can say, okay, it's in the right upper quadrant. It's a way of starting to narrow things down for helping to make a diagnosis. And keep in mind, when you're out in the field, in the medical field working, you're often writing notes down or dictating notes. You may not actually physically see the person that you have to relay this information to. So they're going to have to go off your notes. Well, the patient has a pain in the abdominal pelvic region. Well, okay, can we narrow that down? Because that could be this whole entire region right here. That's not helping me a whole lot. So let's narrow it down. We can divide it into even smaller regions than those quadrants. We can divide it into 9 different regions. You have the right hypochondriac region, the epigastric region, the left hypochondriac region, You have the right lumbar region, the umbilical region, and the left lumbar region. And then the right iguanal region, the hypogastric or the pubic region, and then the left iguanal region. This is showing with the quadrants versus the regions, and the markings kind of overlying where different of the abdominal pelvic organs are. Things such as down here, this little green thing right there, that is your gallbladder. So if somebody is having pain from the gallbladder, now sometimes you feel the pain in a different area, but this can kind of help you a little bit. Oh, okay, pain's right here. You might want to be thinking of the gallbladder. One thing just to mention that some of you may be aware of, as parents, and I'm a parent myself, so I'm just as guilty. When we have little toddlers, we tend to often, they come to us and they're complaining that they have a pain right in this area. And let me switch colors just so it might be a little bit easier to see. In this area, they'll be complaining, oh, I have a pain in this area. Oh, does your stomach hurt? Your stomach is way up here. This is the diaphragm. Here are your lungs. The stomach is right up here. Your ribs are coming right up here, so it's kind of just beneath the ribs. If you're feeling pain down here, that's your intestines probably. It's probably gas, if you want to know the truth of the matter. So knowing the regions, once again, knowing which organs are laying within those regions will help you to make diagnosis sometimes. There are various body cavities. The axial division does contain two major body cavities. You have the dorsal cavity and the ventral cavity. As the names would imply, the dorsal cavity is in the posterior section. It does contain the central nervous system. It can be subdivided into two smaller cavities, the cranial cavity, which is going to basically be the cavity that is formed by the bones of the skull, and it's going to house the brain. And then the vertebral or spinal cavity is going to be protecting the spinal cord. The ventral cavity or the anterior cavity is also subdivided into two smaller cavities, and the division for that is going to be the diaphragm. Above the diaphragm is going to be the thoracic cavity. Below the diaphragm is going to be your abdominal pelvic cavity. Your thoracic cavity, we love to organize and subdivide things, so it can also be subdivided into the two pleural cavities. These will pleural, this means it's going to be surrounding the lungs, and then in the middle between those two will be a region that's known as the mediastinum, and it contains the pericardial cavity. That's what surrounds your heart. The abdominal pelvic cavity is often divided into abdominal cavity and then the pelvic cavity that is below it, but there's no sharp physical distinction between them. There are additional body cavities, such as your orbital cavities that contain your eyes. There's the nasal cavity, the oral cavity. These we tend to study when we are looking at those particular systems and those particular organs. Like when we study vision, we'll look at the orbital cavity then. So in this diagram, let me try to pick a color that's different from everything else that maybe you can actually see. You can, from this lateral view, meaning the side view, in yellow is your dorsal cavity. This is the cranial cavity that contains the brain, and then the vertebral cavity or spinal cavity that contains your spinal cord. And then in the front you have your ventral cavity, which contains the thoracic cavity. The division, remember, was that diaphragm. And then beneath that you have your abdominal pelvic cavity. Basically, like I said, there's not a distinct division, but it's kind of along the hip line. Most of your intestines are in the abdominal cavity, and then the pelvic cavity contains the reproductive organs, the bladder, the rectum. And in this anterior view of the thoracic cavity, you can see that right in here is the pericardial cavity, so the heart's going to be in here, and then your pleural cavities containing your lungs. Serous membranes, these are very thin protective layers, very thin membrane that's going to line like the pleural cavity, the pericardial cavity. What it's going to do is help to reduce friction, because obviously your heart and your lungs are constantly moving. And so anytime you have movement and possibly two things rubbing against each other, that can create friction, that increases heat, and you don't want that. Excuse me. And so the serous membranes do produce a fluid that's going to help reduce that friction. The parietal layer is the part of the membrane that lines the cavity wall, and then the visceral layer is what is covering the internal organ. It's kind of like a double layer. Sometimes we give these membranes specific names depending on where they're found. So the pericardium is going to be around the heart. The pleural is going to be around the lungs. Pleural pleurisy is when this membrane becomes inflamed, and it's going to be painful because it's going to hurt every time you inhale and exhale. The peritoneum is the membrane that's found in the abdominal pelvic cavity. Like I said, it's like a double membrane, so this is trying to show like with the heart. The visceral pericardium, the visceral membrane, is going to be right up against the organ. And then the parietal one is the outer one from the visceral, and then this here is the cavity right here that has the fluid in it.